Your skin is the largest organ you have, and sometimes it talks. A rash can be your body saying it touched something it doesn't like, caught something it's fighting off, or occasionally warning you about something deeper. The tricky part is that many rashes look almost identical on the surface. A red, itchy patch could be eczema, a fungal infection, an allergic reaction, or something else entirely. And color alone doesn't tell the full story. Shape, texture, location, timing, what makes it better or worse, that's where the real clues live. So over the next 10 minutes, we're going to break down the most common rashes, what actually causes them, and what separates one from another. Before we get into specific conditions, here's the mental framework doctors use. They ask a short set of questions. Is it itchy, painful, or burning? Is the skin dry, raised, blistered, or crusted? Did it appear suddenly or build up over weeks? Is it in one spot or is it spreading? And critically, is there a fever or any other symptom alongside it? These questions aren't just formality. Answers to each one dramatically narrow the possibilities. Keep them in mind as we go. Let's start with inflammatory rashes, the kind that aren't caused by infection, but by the immune system overreacting or misfiring. Atopic eczema is probably the most common. It's a chronic condition where the skin barrier breaks down, letting moisture out and irritants in. The result is dry, intensely itchy skin that flares and calms in cycles. It tends to show up in the folds of the elbows, behind the knees, and on the face. It's not contagious. It often runs in families, and people with eczema frequently also have asthma or hay fever. Contact dermatitis looks similar, but the cause is completely different. Here, the skin is reacting to something it touched: a metal, a fragrance, a plant, a cleaning product. The rash typically stays exactly where contact happened. Remove the trigger, and the skin eventually settles. Seborrheic dermatitis targets areas rich in oil glands: the scalp, the sides of the nose, the eyebrows. It produces a greasy, flaky irritation that's often mistaken for dry skin or dandruff. The underlying driver is a yeast that normally lives on skin but occasionally overgrows. Psoriasis is a longer-term immune condition. It causes a rapid cycle of skin cell turnover, producing thick, well-defined plaques with a silvery scale on top. Unlike eczema, psoriasis often affects the outer surface of elbows and knees. It's not contagious, and for many people, it's a lifelong condition that waxes and wanes. Rosacea mainly affects the face, the cheeks, nose, and chin, with persistent redness, visible vessels, and sometimes acne-like bumps. It's often triggered by heat, spicy food, alcohol, or sun. It's not infectious, and it's frequently mistaken for adult acne. Now shift to rashes driven by external triggers. Hives, also called urticaria, are the classic allergic rash. Raised, pale, intensely itchy welts that can appear anywhere within minutes of an allergic trigger. The defining feature is that individual welts move. A welt that disappears from one spot and reappears elsewhere within a few hours is almost certainly hives. Most cases resolve on their own, but if there is swelling of the lips, eyes, or throat, or any difficulty breathing, that is an emergency and requires immediate care. Heat rash happens when sweat ducts become blocked. Small red bumps or clear blisters cluster in areas that stay warm and covered: the neck, chest, or underarms. It's common in hot climates and usually clears once the skin cools and breathes. Insect bites produce localized swelling and itching, usually in small clusters. Allergic plant reactions, from poison ivy or similar species, typically produce streaky, blistering rashes in the pattern of contact, appearing hours to days after exposure. Infectious rashes are a separate category entirely, because many of them can spread to other people. Ringworm has nothing to do with a worm. It's a fungal infection that spreads across the skin in a ring-shaped pattern, raised at the edges, clearer in the middle. It's contagious through direct skin contact or shared objects. Impetigo is a bacterial infection, most common in children. It produces crusted, honey-colored sores, usually around the nose and mouth. It spreads easily by touch and requires treatment. Scabies is caused by a microscopic mite that burrows into the skin. The hallmark is intense itching that gets significantly worse at night. It often affects the fingers, wrists, and skin folds. It spreads through prolonged skin-to-skin contact. Shingles appears as a painful, burning band of blisters on one side of the body or face. It's caused by the reactivation of the chickenpox virus, which can lie dormant in nerve tissue for decades. The pain often precedes the rash itself. Viral exanthems, rashes triggered by common viral illnesses, typically produce a widespread blotchy redness across the trunk or body, often alongside fever or mild illness. They're usually self-limiting. Hand, foot, and mouth disease produces small, painful sores in the mouth and flat spots or blisters on the palms and soles. It's most common in young children and spreads through contact. One important point: inflammation doesn't always look red. On medium and darker skin tones, a rash may appear purple, brown, grayish, or simply as a change in texture rather than color. Medical images have historically skewed toward lighter skin, which means rashes in darker skin are sometimes harder to recognize. And that's worth knowing. Slow down here, because this part matters. See a doctor promptly if a rash spreads quickly, becomes painful rather than itchy, appears alongside fever or illness, causes blistering or peeling skin, or involves the eyes, mouth, or genitals. Also act promptly if you notice pus, yellow crusting, or red streaks extending from the rash. Those are signs of infection that need assessment. And again, if there is swelling of the face or throat, or any trouble breathing, treat it as an emergency. A rash is never a diagnosis on its own. The pattern, the timing, the symptoms around it, and where it lives on your body all carry equal weight. Most rashes are temporary and manageable. Some need a doctor's eye, and a few need prompt attention. If your skin is telling you something and you're not sure what, get it looked at. That's always the right call.